What do you
Yeah.
what do you anticipate the priorities are going to be coming out of the pandemic, whenever that is?
Yeah. I think that, I mean, we've learned a lot in the industry. It's almost embarrassing how much there's no flu season this year because of our isolation and not bringing people into clinics, but using virtual care for appointments that you can do just as easily or better on video. So, safety wise and quality wise, that's been a significant advancement. We also have a significant goal to improve access. And a lot of this, it's in really two ways. One is geographically, it's very hard to drive into Stanford from anywhere in Northern California. It takes a parent or another adult every time a child has to come for an appointment. But I think the other thing is for people who are underserved. Digital health can break the barrier of access difficulties and geo access difficulties. And we actually are starting a program with our foundation to enable technology for those that don't have access to it, so that we can reach a broader audience at a more, the later things happen, the worse the outcome. So the earlier we can get upstream and screening and saying, yeah, you should come in for an appointment, or no, we don't need to, you can do this. We're seeing tremendous growth in that and much broader access for patients. The other thing that happened during COVID is they relaxed the interstate restrictions. So we're seeing patients from other states now that we weren't able to before because of the relaxation on that and the credentials for that. I think I mentioned the other thing, that we treat very complex patients that are long-term, chronic, complex. And so we need to keep them in our care or be a partner in their care for long periods of time. And so we can predict when their next intervention is needed. Finally, I'd say this, Bill. One of the things that distinguishes us in our innovation and our digital health is that we literally apply it. We see a problem and we say, why can't we solve that problem with technology? And because of that, we're testing and iterating right in the clinical environment, as opposed to a laboratory that we now got to go pilot it in. We're actually doing it real time. So it excites our clinicians to see improvement, and we're right there improving the care process with real world problems.